Hey everyone, today we're diving into a really interesting and honestly a kind of hidden side of modern medicine, venous complications. These are the unexpected problems that can pop up during the very procedures that are supposed to help us, sometimes turning a routine intervention into a really critical situation. All right, so here's how we're going to tackle this. First, we'll get a handle on what we're even talking about. Then, we'll look at what happens when a vein gets directly injured. After that, we'll explore some of the troubles with modern devices, like stents and filters. We've got a whole section on when safety filters go wrong. And finally, we'll see how doctors are working to prevent and manage all of this. So, what exactly is a venous complication? Well, it can be anything from a simple bruise all the way up to a life-threatening internal bleed, or a dangerous blood clot, or even an abnormal connection forming in our circulatory system. And the key thing here, all of these can stem directly from the medical treatment itself. To put this in perspective, let's start with a question. If you had to guess, what do you think is the single most common venous complication people face after surgery? It's a condition you've probably heard of, but I bet the numbers behind it will surprise you. Yep, the answer is deep vein thrombosis, or DVT. That's a blood clot, usually in the leg, that can cause some pretty serious issues. And get this, after certain kinds of vascular surgeries, the rate can be as high as 20%. 1 in 5. That really shows you why this stuff matters so much. Now, this brings us to a word you're going to hear a lot today, iatrogenic. It's a fancy term, but all it means is that the injury is an unintended result of the treatment itself. Now, this isn't about a doctor making a mistake. It's about the inherent risks that come with messing with the incredibly complex machine that is the human body. And the stakes here are just incredibly high. A complication can be as minor as a bruise, or it can be a massive, life-threatening hemorrhage. In fact, one study on major abdominal surgeries found these injuries came with an 18% mortality rate. That's why spotting them early is absolutely everything. Okay, so how does this actually happen? Let's start with the most obvious cause. Direct physical damage. We're talking about when a needle, a wire, or some other instrument physically punctures or tears the wall of a vein. And believe me, this is more relevant today than ever. The number of procedures where doctors need to access our veins has just skyrocketed. We're talking about a 10-fold increase since 1995. And, well, more procedures simply means more chances for these kinds of access site problems to happen. One of the scariest direct injuries has to be a retroperitoneal hematoma. Just imagine a slow leak happening in that big, open space at the very back of your abdomen. It can collect a ton of blood before you see any obvious external signs, which makes it super difficult to catch early. So, with a danger this hidden, how on earth do doctors find it? Well, they're trained to look for a whole cluster of signs. It's not just one thing. It's the combination of back pain, a sudden drop in blood pressure, a racing heart, and a weird dip in your red blood cell count that all together scream, hey, there might be an internal bleed here. Another type of direct injury basically creates a short circuit in your body's plumbing. It's called an arteriovenous fistula, and it's an abnormal link that forms between a high-pressure artery and a low-pressure vein. This can happen if a needle accidentally passes through both, creating this little channel that totally messes up normal blood flow. But it's not just about direct physical pokes and tears. Sometimes the very tools that are designed to fix us, the stents, the wires, the coils they use inside our veins, can actually become the source of the problem. Take stents, those little mesh tubes that prop open a vein. One of the biggest worries is something called migration. See, unlike our arteries, which are pretty rigid, our veins are soft and flexible. If a stent isn't sized perfectly to push against that vein wall, it can just get knocked loose and start traveling through your bloodstream. And that, as you can imagine, is a very bad situation. Doctors have this perfect analogy for it. They call it the watermelon seed effect. You know how if you squeeze a wet watermelon seed, it just shoots out from between your fingers? Well, a stent that's not anchored just right in a flexible vein can do the exact same thing, suddenly turning into a dangerous projectile inside your body. And migration is only part of the story. Those stiff guide wires they use, they can accidentally poke right through the vein wall. The newer, stronger stents can sometimes press on nearby nerves, causing horrible flank pain for months. And even the tiny little plugs and coils they use to block off veins can break free and end up in the lungs. All right, now for a really fascinating case study. We're going to look at a device that was designed specifically to prevent a major complication.
But, and here's the paradox, it can sometimes cause a whole new set of problems all on its own. Meet the Inferior Vena Cava Filter, or IVC filter. It's this small, kind of spider-looking device they place in the body's largest vein. Its whole job is to catch blood clots before they can get to the lungs and cause a deadly pulmonary embolism. It's an absolute lifesaver, but the device itself comes with some pretty significant risks.
And what's interesting here is that there are two different windows for trouble. First, you have the immediate risks that can happen during the procedure itself, like putting the filter in the wrong spot. But the danger doesn't stop there. Late complications can show up months or even years down the road, as the filter itself starts to wear down, form its own clots, or even break and puncture the wall of the vein. So with all these potential pitfalls, you're probably thinking, okay, so what are they doing about it? How do medical teams actually handle these things when they happen? And maybe more importantly, how do they stop them from happening in the first place? Well, prevention is absolutely the name of the game. This means using tech like ultrasound to literally watch the needle in real time to avoid any accidental pokes. It also means identifying patients who are at higher risk and using advanced imaging from inside the vein to get a perfect size for a stent. And, really crucially, it means taking out temporary devices like those IVC filters as soon as they're not needed anymore. But if an injury does occur, the medical team just springs into action with a very clear playbook. First things first, they stabilize the patient, make sure their blood pressure and heart rate are under control. Then they focus on stopping the bleeding, using anything from simple pressure to even an inflatable balloon inside the vein. Once things are calm, they'll get a CT scan to see exactly what's wrong, and that tells them the best way to go in and fix the damage.
So when you boil it all down, it really is a delicate balancing act. Every incredible new medical device or procedure that comes along and saves lives also brings with it a whole new set of potential and sometimes unexpected risks. The real story of medicine is just that constant effort to tip that balance more and more in favor of the patient.
And that kind of leaves us with one final thought to chew on. As our medical tools get more and more powerful, letting us do things inside the body we could only dream of a few decades ago, the core challenge really stays the same. How do we make sure that our clever new solution doesn't accidentally become the next big problem?